Hi, everybody. Dr. Sylvestre here. Well, I'm going to do the second installment in my referral series, and that's the difference between a board-certified surgeon and a general practitioner who has taken extra training, extra courses in surgery. I do feel this is an important topic, the boarded surgeon versus the general practitioner who has a bit of extra training, because I do know that even the general practitioners using these other non-boarded surgeons may not appreciate where the limitations are, or may not appreciate where the benefits are of using a non-boarded surgeon. There's a couple of important points to make. The big difference between a boarded surgeon and a general practitioner who's gone on to take a course on how to do a TPLO, for instance. Maybe they've taken a couple of those weekend courses, how to do a TPLO, and they're comfortable with using a drill and saw. The big difference is in the foundation. When it comes to the discipline of surgery, the board-certified surgeon has a depth of knowledge that cannot be attained by somebody who has not done a surgical residency, by somebody who has not spent at least 4 years of their life just studying surgery, studying the journals, taking courses, and working under the influence of several mentors. That is the main difference. Having said that, surgery, as some of the internists likes to keep on pointing out to us, it's just mechanics. It's putting things together and moving things around within the body. It's mechanics. Surgery is a numbers game. The more of a certain procedure you do, the better you get at it. That's it. The more you do, the better you're going to get at it. So for a general practitioner who's taken a certain surgical training course, the key is, will he or she see and do a sufficient number of those cases to get good at it? If the course they took is a TPLO, well, there's an abundance of cruciate issues in dogs, and therefore, yes, they will for sure see enough TPLOs, and yes, they will get very good at the TPLOs. The key is to stick with the routine cases. Whenever you learn how to do a surgical procedure, you need to understand case selection. And there are cases that just naturally are going to have a better prognosis. And there are other cases that are naturally just going to be a lot more difficult. Why? Because despite the problem being routine, that particular case may not be. What do I mean by that? So let's take the case of a TPLO. You have a 30-kilogram Labrador that has cruciate disease, needs a TPLO. That is common and routine. You have a 240-pound Mastiff that has cruciate disease and needs a TPLO. While it's a common problem, the 240-pound dog is not routine. And just having that dog in your OR will bring with it a whole slew of different difficulties that, again, unless you have a depth of knowledge, you may not be able to foresee. Maybe the patient is a 30-kilogram Labrador that has cruciate disease and needs a TPLO, but it also has Cushing's, it also has a blood clotting disorder. Maybe there's a bunch of other things going on in that dog that makes the case neither routine nor common. That would be one way of looking at routine and common. So if you have a routine, common case, then yeah, maybe that general practitioner who has gone and taken an FHO surgical procedures course or a TPLO or an extra cap can really come out and help you in a more timely fashion that maybe trying to get the case referred to a board certified surgeon. However, if the case is neither routine nor common, it would be best to seek the board certified surgeon, because as the hiccups and the challenges show up in surgery, we're better equipped to deal with them, because that is what our training is. It's not a superficial knowledge base, it's a very deep knowledge base. So when the hiccups come, we can just go a little bit deeper with what we know and find a solution, deeper still if necessary. The other type of case that may not be ideal for a general practitioner with extra training within a surgical procedure is one that has a complication. So maybe it was a routine, common case, but a complication developed. Those are cases that maybe it would be best to send them off to a board certified surgeon to have the complications dealt with, because again, it's a numbers game. The board certified surgeon will do more of these surgeries in a day, in a week, and therefore is going to see more complications and should be able to manage the complications in a much more efficient manner with a probable better outcome. In a nutshell, that would be the difference between the board certified surgeon and the general practitioner that has taken extra training or a specific surgical course. Think about it in this way. You want to host a dinner party and you can get Chef Gordon Ramsay to come and prepare the meal for you, or you can get somebody who owns a recipe book and likes to cook to come and prepare the meal for you. So, maybe if it's just you and some friends and you just want to have a good time and you don't want to cook, well, the guy or the gal with the recipe book can do a great job for you and will accomplish what you need to have accomplished. But if you are actually entertaining royalty and you want like a really special meal and preparation and you want it to be tasty and perfect, maybe you want to get the trained chef to come and do that for you. Hopefully that makes a little bit of sense. Thank you for listening. Have a great day.